Hey everyone, it's me Mel. I hope you're doing okay. I just wanted to do a little follow-up video from my last one. So obviously in my last video I was talking about my health issues and the reason why I've been so absent from my channel. I've recently been diagnosed with endometriosis and I just wanted to do a follow-on just to talk about a little bit of background and how I've got to this point. I know there's a lot of people out there that may find this quite beneficial. No two journeys are the same, but some people do experience maybe some of the symptoms that I've had and still having. I just hope this can help in some way. I think it's important that we try to, normalise talking about periods, and raising awareness about this condition. I had heard of it before. I had heard of it, but now that obviously I've been diagnosed with it, I'm trying to educate myself as much as I can. I hope this could be some help to someone. Just a little bit of background. For me, I started my periods when I was 14. I was kind of, obviously one of the late ones, but I just remember very early on that my periods weren't the same as my friends'. I remember they were painful, quite heavy, and just really hard to sort of get through them. It was just that dread, when that time's coming. I kind of just thought, my body's getting used to what's going on and it will settle down. So when I was 15, I went to the GP and I was put on the pill, and I was on that for 7 years. During the 7 years that I was on it, I was still experiencing the painful periods, the heavy bleeding, and they started to become irregular as well. So I was bleeding, outside of when like my breakthrough bleeding would come through. I was bleeding, a week later, 2 weeks later sometimes. And I just thought something wasn't right. So I went back to the GP and I asked, can you send me for some tests or, some scans or something, because I was starting to experience pain as well. Not just during the period, but before it, after it, I was getting a lot of pelvic pain. I went to have the ultrasound done, and the results came back as normal. So I just thought, okay, well, it's obviously been checked, thought nothing of it. And during the next few years, I started to have a lot of stomach issues. So I was experiencing bloating, I was having difficulty eating, so lack of appetite, I was vomiting, I was having a lot of abdominal pain, and fatigue as well. I just felt exhausted, just wiped out, and chronic back pain as well. So quite a lot of symptoms. And again, I went to the GP and I felt like I kind of needed to push a bit harder. I did have to say about my dad, the fact that he had gastric cancer. Obviously I know that it's not necessarily hereditary, but my health anxiety was just playing all sorts of games with me, and I was thinking the worst. Is this a sign of something? So I went to the GP and I ended up having a few, I think they're called endoscopies. I'm not sure if that's the right way of saying it, but I had the camera down into the throat, into my stomach, and they just had a little look to see what was going on. And I was basically told that I had severe gastritis and IBS. So I was given some medication for the gastritis, and I was referred to see a dietitian, and I was told to try out the FODMAP diet. So I tried that out. I did a pain diary, I did a food diary, and tried to see if there was any triggers or anything that would set off my symptoms, anything that would calm it down. But in all honesty, it just remained the same. I was really starting to worry. I felt like something wasn't quite right and something had been missed. So I just kept, going back to the GP. I was kept being given different medications to try. And so it was 2015 that I had my first child. And in all honesty, I feel truly blessed, to be able to have my boys. I know there's a lot of people out there that are struggling to start a family, and I honestly feel truly blessed, and I'm sending lots of love to you guys, and I'm really hoping that everything works out for you all. But for me, I did conceive quite quickly with both of mine, and I did find it quite difficult during the pregnancies. I struggled really badly with the chronic back pain and the pelvic pain, and as much as I love being pregnant, it was a bit of a struggle, and yeah, it only kind of got worse after I actually had the boys. So with my first son, I had cesarean, and after I had him, obviously Mother Nature, the period started again, and yeah, they were just all over the place, really irregular. Same again, just really painful, heavy, and I just felt like this can't be what it's going to be like. But I wasn't on the pill at this point. I decided not to go back on it, and just see, you know, what my true periods were like. And yeah, I instantly thought, no, I can't continue like this. But in the same breath, I didn't want to go back on the pill because I'd had weight gain, the mood swings were awful, and I just didn't feel like myself. So I just thought, I'm just going to try and grin and bear it. And yeah, you know, for a few months it was okay, but then I had to go back to the doctors again because I was just so worried about these irregular periods and just the pain. And it was, like I say, it wasn't just during the period, it was leading up to it, it was after. So I asked for another scan, and this one was an internal as well. So yeah, not the most comfortable, but I just needed some answers. So I had that, and again, the scans come back normal. So I was feeling pretty frustrated at this point, but again, I just sort of just thought it's just me. The doctors don't seem that worried, and yeah, at this point I'd never been referred to a gynaecologist or anything like that. And then yeah, queue up to this point, quite a big leap, but yeah, for the last say 9 months now, I've been experiencing daily pain, chronic pain in my lower back. It's all right-sided, so it's in my hip, it's in my pelvis, sometimes in the groin, and yeah, I've just been feeling very fatigued, completely wiped out, leading up to the period, during, after, just never any let up from the pain. And yeah, even now I'm currently wearing my TENS machine, my trusty TENS machine is getting me through this video. But yeah, so for me, yeah, 9-10 months ago now, I experienced this pain, and I've had it obviously all these years, but it just wasn't going away. Despite taking pain relief, it just wasn't budging. So I went to the GP, and it was the first time that I'd heard about endometriosis, and it had kind of been brought up in the conversation. And yeah, in that time as well, I'd been admitted to hospital because of the pain. I'd ended up going to A&E, and I was told that I had pelvic inflammatory disease, and I stayed in for 2 days, and then I was given medication. So I was given antibiotics for 2 weeks, see how I go. And yeah, obviously I took the medication, made me really poorly taking it with all the side effects, and yeah, the pain was still very much there. So I went back to the GP, and they said that possibly I had a urine infection, but obviously I had my urine checked and everything was fine, so they were a bit puzzled. And then I mentioned about the endometriosis again, and said that I wanted to be seen by a gynaecologist, and I really had to push. You know, I had to see another doctor. I asked to be seen by another doctor because this other one wasn't taking me seriously. And yeah, he agreed to refer me to a gynaecologist. So that's what I did. And when I went for my first appointment, I was seen by a lovely doctor, and he basically said, we'll try you on the pill for 3 months, and yeah, come back to us, and if you're no better, then we'll book you in to have the laparoscopy. And I said, oh, okay then, is that all we're going to do? And he said, yeah, just see how you go. And I did feel like reassured. I felt like, you know, I did have to have checks and stuff there, and like, yeah, he gave me a good sort of looking over and whatnot. So I felt like I was in, you know, good hands. And yeah, I ended up taking the pill. Bearing in mind I hadn't taken it for like 8 years, and yeah, I was bleeding for like over 40 days, and I just basically said to my partner, I can't do this. Obviously I'm a mum, I've got 2 boys to look after, and yeah, it was just having a massive effect on me, not just physically but mentally and emotionally. It was just a lot. So I said I'm not going to continue on with it, and he agreed. He said don't take it, go back to them and say it's not working, you can't possibly do it for another couple of months. So I had to push to get my my next appointment expedited, just making various phone calls, sending emails, and I ended up getting seen by another gynaecologist, and he basically said that he wanted to put me down for the laparoscopy, but due to COVID you're going to have to wait, it's looking at about 6 months. And obviously I was just full of emotion, I was in tears, and he said, I really, really want to help you, but we've got a lot of other patients, and yeah, you're just basically going to have to wait. And basically I went home, obviously I couldn't have my partner there with me, and yeah, I basically just said to him, look, this pain is not going away. I ended up having another 2 hospital stays within the time of trying to wait for this surgery, and yeah, no pain relief was taking the pain away. And yeah, we don't have a lot, but I said to him, we're going to have to club together and I'm going to have to go private. And that's what I decided to do, and obviously it was a good decision, because I ended up having my surgery in June, and I was diagnosed with endometriosis, and I also had extensive scar tissue removed from the right side. So in my heart I thought, the scarring's been taken away, possibly that's what was causing the pain, and that is what the consultant said, because the endometriosis was actually found on the left side. I can't say the name of the place where it was found. I think it's called like perinatal something. So basically in the abdominal area. So that probably would, now I can understand why I had the stomach issues, and all the symptoms have kind of all sort of come to this. It's come to this endometriosis diagnosis. So yeah, I've obviously had the surgery, but as I said in my last video, unfortunately for me, I haven't felt any better despite having the surgery. Obviously I'm feeling really glad that I do have the diagnosis, and I know that this wasn't all in my head, but yeah, I'm still experiencing this chronic pain, along with the other symptoms. So for me, I'm going to be continuing with this journey. I'm going to be pushing, and that's what I would urge anyone to do right now that may be in a similar position, is you do need to advocate for yourself. I've been doing it my whole life, so yeah, I'm pretty hot on that sort of thing. But yeah, it's definitely making the phone calls, sending emails, and making a nuisance of yourself, really, because at the end of the day it's your body, and it's you that's feeling the way that you're feeling, no one else. So yeah, definitely keep pushing for answers, because yeah, we're entitled to them. But yeah, I'm going to continue talking about my my journey with endo, and yeah, like I said, I hope it will help anyone else out there. But yeah, like I said in my other videos, if you do like my videos, please give me a thumbs up, continue to share, subscribe to the channel, and let's just keep raising awareness, not only to endo, but normalising grief as well, because obviously a lot of my videos are to do with my grief journey, and just how hard I found it, especially recently with the fact that I haven't got my parents here, and I would very much like them to be by my side right now. But yeah, I'm just so glad that I've been able to do these videos and just share all my thoughts and feelings, emotions with you guys. So yeah, thank you so much for watching, and I hope to see you in the next video. Remember, stay real. Take care, guys.